I'm delighted to be joined today by the director of the LA Department of Public Health, Dr. Barbara Ferrer. So nice to have you here.
Oh, thanks so much for having me, Maria.
Just even doing my research, it seemed incredibly overwhelming to think about what the Department of Public Health is responsible for. But in general, obviously, you know, we'll get to the enormous issue with the pandemic, but it is so much more than just that. What are the things that you focus on?
There's 4,500 employees, there's almost a $2 billion budget, and we have a huge mandate to make sure that everybody has the resources and opportunities they're going to need to be as healthy as possible. We're really focused on sort of an equity agenda. You know, we all used to think it was about going to the doctor, and that's an important component, don't get me wrong. But so much of what determines our health and our well-being is really rooted in the conditions in which we live. You know, a good example is, 25 years ago, the Public Health Department may have done a huge campaign telling people how important it was to eat healthy. Well, we know that, yes, it's super important for us all to eat healthy, but your ability to eat healthy depends on your access to affordable, healthy foods. So you're going to see a Department of Public Health like ours making sure you have access to affordable, healthy foods, trying to get rid of what we call those food deserts. We're going to worry about climate change. We've got to get clean air, we need clean water, we got to get the lead out of our soil. So you'll see our Public Health Department really working on all fronts.
The issue still exists. So where are we and how are we? I mean, are people still dying from COVID?
Black and brown people still tend to have higher rates of cases, hard to measure now, but higher rates of hospitalizations and higher rates of death than everybody else. We also see that people who live in communities that have higher rates of poverty, same thing. Now we're averaging about 1.5 deaths a day. I mean, you all remember when I reported 300 deaths in a day, 400 deaths in a day. So things are so much better. One thing we learned is we have to protect workers. If there's one place where I feel like we missed at the beginning, it was understanding the disproportionality that was going to play out amongst workers, especially our essential workers, who were never going to go home, who couldn't really distance, who worked in crowded conditions. So for me, the work ahead is let's improve ventilation. We know what a difference good ventilation is going to make, not just for COVID, for other health issues,
Sure.
other respiratory viruses.
And if people want to get information, what is the site that
Yes, so
to?
people can go to publichealth.lacounty.gov.
Okay. All right. Well, thank you so much, Dr. Ferrer. And it's really wonderful to have you here with us, and I hope we get to see you again soon.
Thank you. Thank you for having us.